Hey, y'all, it's Michelle with SLP Full Disclosure. Welcome to the podcast today. We have an amazing guest with us today, Miss Stefanie LaManna. She is the Associate Director of Healthcare Services in Speech-Language Pathology with ASHA. So, Stefanie, thank you so much for joining us today. I'm excited to have you here.
Thanks, Michelle. I'm so excited to be here.
And we are going to be talking about social determinants of health, something that Stefanie said that she loves talking about. And we're going to be talking about it and how it affects us as SLPs and treating our patients no matter what healthcare setting we're in, whether in a school, home health, hospitals, and how we can go about addressing these issues to provide equity in healthcare services. Developing appropriate treatment plans as we move forward with our families and patients. So that's what we're going to be talking about today. So let me tell you guys a little bit about Stefanie. Stefanie is an SLP with experience in pediatric acute care, NICU, inpatient rehab, and community settings. At ASHA, she focuses on supporting SLPs working in pediatric healthcare and feeding disorders. She's devoted to neonatal airway disorders and family-centered care. Wow. Lots of specialized trainings, things that as a speech pathologist in the school system, I know nothing about. So I would love to pick your brain sometime, but we're not talking about that today, but that is very interesting to me. So,
Sure.
Stefanie, tell us a little bit about your career, where you've been as an SLP, and how you ended up at ASHA.
Sure. Yeah. I always kind of when I talk to people about my story and where I've been, I always start with I always knew I wanted to work in the NICU. Like
Uh-huh.
no one really knows that they want to work in a specialty area like that. I mean, some people do, but it's really common for people to go into undergrad or graduate school and not have any idea of what they wanted to do. But I was like, nope, I'm going to work in the NICU.
Wow.
So I really kind of focused on that path. And when I graduated grad school and went into my clinical fellowship, I started kind of backwards working in pediatric outpatient with babies and toddlers and children with feeding issues, as well as speech and language. So I kind of got this really nice wide range of experience.
Mm-hmm.
And then just kind of moved on from there, went to peds and patient rehab, and saw a little bit of everything. And then I worked in the NICU for probably like 6 or 7 years at a community hospital where I live, and I loved it. And it was fantastic. And I learned so much while I was there. And then I came across an opportunity to come and work for the ASHA team. And I just kind of never looked back. And I'm really happy about the work that I'm doing here.
That is amazing. The medical setting always intimidated me for some reason. I think it's just something I think those little bitty sick babies would scare me. So I'm so glad that we've got speech pathologists like you out there. So we're going to be talking about social determinants of health. I think it's something that we all know about and we know exist, but that term, social determinants of health, is not something that's widely spoken about. We rarely hear that term, although we talk about those things, we don't talk about them in those terms. Would you agree with that?
Yeah, for sure. I mean, when we talk about what they are and what that word means, everyone's like, "Oh, I know exactly what you're talking
Right.
about." But it's kind of like the terminology
Mhm.
that's new to people.
Right. So tell our listeners, define social determinants of health for us in your terms.
Sure. Yeah. So I'll start with sort of like the technical definition of it
Mhm.
because it is important to know. And this social determinants of health sort of movement, I guess you could call it right now,
Mhm.
is being pioneered by Healthy People 2030, which is part of the Department of Health and Human Services and the Office of Disease Prevention and Health Promotion through the United States government.
Okay.
So they define SDOH as the conditions in the environment where people are born, where they live, where they learn, work, play, worship, and age. And those conditions in those environments affect a wide range of health, functioning, and quality of life outcomes and risks. So basically, like to boil that down into something a little bit more plain language, it's kind of where you do everything in your life and the
Mhm.
conditions within those environments and how that affects your health and
Wow.
then your health outcomes.
Right. And how are is there I'm sure that there's lots of research being done, like the research people that do the
Oh,
research.
yeah.
So, what
Yeah.
is the research showing right now and how those social determinants impact your ability to access healthcare?
Yeah, that's a really specific question, I think, in terms of just one social determinant of health, but it's important to know that there's 5 of them.
Right.
And there's, for those who don't know, there's the neighborhood and built environment, so where you live and what your community looks like. There's the healthcare access and quality. There's economic stability, education access and quality, and then your social and community context or your people, your village, right?
Mhm.
And research is developing around all those different social determinants of health. But, really what we're sort of finding is that social determinants of health are neutral. They are not inherently positive or negative, but it's sort of what happens within the context of your life that then affects your ability to access certain things or to have positive or negative health outcomes. So if you don't mind for a second, I'd be happy to sort of talk about what those terms
That
mean.
that was my next question. So, yes, talk about what those terms mean, definitely.
Yeah, sure. And I'd be happy to share after this. We have a bunch of resources related to SDOH on our ASHA website. So anyone listening to this doesn't have to like memorize all this
Right,
information
and
right
we'll
now.
make sure to have
Uh,
all of that linked in the podcast, so that would be fantastic.
Perfect. So SDOH really refers to the variables that are shaped by policies, infrastructure, and culture. So you and I might share SDOH. We might live in the same neighborhood and built environment, for example, or
Mhm,
we might go to the same school,
mhm,
or maybe we're a part of that same village of people.
right,
And then there's also a couple different parts of SDOH, which include protective factors, social risk factors, and then social needs. So really what those are what really should matter to the SLP when we're thinking about our patients. So those 3 terms refer to how SDOH relate to clients on that individual level.
okay,
So protective factors are sort of like those circumstances that benefit a person's well-being and their health outcomes. So think about having access to like really abundant nutritious food, you live in an environment that has clean air, you have family that lives near you, friends that live nearby, you have a strong support system, right? Those things all help you can help you have better health outcomes because you have a support network.
right,
You're living in a healthy place.
right,
Meanwhile, the opposite of that is social risk factors. So they're the circumstances that are associated with poorer health outcomes. So think things like housing insecurity, not having access to transportation, social isolation. So
mhm,
if you don't have a place to live, you don't have a way to get to appointments, you don't
mhm,
have a support network, you're more likely to have poorer health outcomes,
right,
right? That sort of makes sense to
right,
us.
mhm,
And then the last part is social needs. So they arise due to gaps in access to goods and services. So a good example of that would be like if a baby requires like a specialized bottle or nipple system after being discharged from the hospital, but it isn't sold in any of the stores near their house.
right,
So that is kind of that need that then arises, which gives us a good opportunity to intervene.
right. Why is it so important for speech pathologists to consider all of these social determinants when creating treatment plans and outcomes and that sort of thing?
Yeah, that's a great question. And I thought about this for a while before our conversation. And what I really kind of boiled it down to is there's a great quote on our SDOH resources on our website that says social determinants of health help contextualize the relationships between health inequities, health disparities, and healthcare disparities your clients face. And I really love that. And the way we can kind of plain language that up a little bit is that everyone has SDOH, right?
Mhm,
You have it. I have
mhm,
SDOH. An example I give a lot because I'm not afraid to talk about my own SDOH in front of people
right,
is that my husband and I live far away from family and our closest friends are over an hour away from us. So if something happened to us, we don't have a strong support system in our direct area because all the closest people to us live far away. And that potentially, while we do have a strong support system of people who are willing to drop everything and come and be here for us if we need it, that protective factor can then shift into a social risk if something, devastating were to happen to us or if we just needed support. A good example of that is like childcare, right? Like we don't have anyone to help
mhm,
us with
yeah,
childcare. So I kind of think about it as if the SLP doesn't ask about SDOH, the downstream effect of that might be like if they're in an outpatient setting, they might like dismiss a patient from their caseload who has missed so many visits or like no-showed so many visits,
Mhm.
right? And sometimes we like hear the word like thrown around by like administrators of outpatient settings, like the word non-compliant, like the patient's non-compliant, they're not showing up for visits, things
Mhm.
like that. But if the SLP doesn't screen for SDOH, they might not know that the real reason why the patient isn't showing up for visits is that they don't have a car.
Right.
And maybe the city they live in recently cut funding for public transportation.
Mhm.
And now the bus routes have changed
Or they
and
don't
bus
have or
availability.
they don't have money for public transportation.
Yeah, they can't afford it, or it takes them 2 hours,
Yeah.
just to take the bus or the train to get to that appointment. And that's not true for everyone, right? Like, but at the same time, screening for it sort of opens those conversations about how can we intervene to help our patients get what they need.
Right. Is there a specific screening? Like, is there an SDOH screener, specific screener that SLPs in medical settings can do? Because I'm thinking about my role as a speech pathologist in the school system. And the kids come to school to access the services that I'm providing.
Yeah.
And that's something that I never really think about too much outside of that education setting. So,
Sure.
what screener do you recommend? Is there one that's specific?
There are some specific screeners on the SDOH resources on our website. We have a specific tab for like tools and support that include a bunch of different screening options, just depending on what your clients like, what your caseloads needs are, what type of setting you're in, things like that. So there's a bunch of different options for SLPs to pick and choose from, what might fit their needs best.
Right. And I'm thinking about when I was working in early intervention when I was in Maryland on contract with AMM when I first started going into people's homes. And then when COVID hit, we went virtual, right? And I
Yeah,
had never worked virtually and I thought to myself, I wonder how this is going to work. Early intervention is parent training, family coaching. It's not that, direct one-on-one therapy. So how is this going to work? Is this going to work? What's it going to look like? And do you know what I
yeah,
found? That I had almost 100% attendance when we went virtual. Families that in the past had been, like you said, non-compliant, no-showed, canceled at the last minute. And
yep,
it was very interesting to me, and I've thought a lot about it since we decided that we were gonna do this podcast, and I was trying to think of situations where those social determinants had impacted the therapy that I was providing in the different settings, and definitely and I think it's because maybe the house wasn't clean. Maybe they didn't have, and even with the kids that were sick, they had a sniffle or they had a runny nose, so they would
sure,
cancel because they didn't want me coming in and getting it and then taking it to other kids. And same with
sure,
me. If I had a stuffy nose or a little scratchy throat, I wouldn't wanna go into their homes. But those are the
yep,
kinds of things and then thinking back to many, many years ago when I first started in my career, in early intervention in Alabama, and just the physical therapy. I remember being in really, really small homes and once the team would go out and do the evaluation for kids that had multiple needs, and the PT would say, they don't have room for a walker. They don't have room for a wheelchair. They don't have room for
yeah.
all of this adaptive equipment. So those are the kinds of things that we're talking about, right?
Yep, exactly. And you raise a really good point about like teletherapy and the access, how that improved access like for your
It
clients.
really
And I think
did. Mhm.
yeah, and that's a great thing, right? Like we want to
Mhm.
lower that bar to access, but the reverse of that also is like a patient who might not have internet access
Mhm.
or consistent internet, right? Like
Yeah.
so this is a good example of how SDOH are sort of positive and or sorry, not they are neutral, but you can have these protective factors that are positive or these risk factors that can be negative in looking at the same sort of situation, right?
Right. And I think it's important you said earlier about for the SLP to screen and make sure that you're doing a good evaluation of this family because sometimes those questions can be difficult to ask. And a
100%.
lot of
Yep.
times parents may not be I mean, they may be embarrassed to say, "Hey, I don't have money. I don't have a car. My car is broken. I don't have gas money. I have a car, but I don't really have gas money this week to come for the therapy appointments." And I remember that a lot because in Alabama, it was set up to where they would have to come into our facility at least once a month or once every 6 weeks, and then we would go out there the other times. But it's really interesting as I've started going through this after we decided on this topic, and I've been starting to think about those specific situations. So, what are some interventions? What are some things that we can do? We've talked about what they are. We've talked about those key factors, but what can SLPs do to improve that to help our families have better access?
Sure. Yeah, that's a great question. And I'd like to sort of start with like, we don't expect SLPs to like fix housing
Right.
insecurity
Mhm.
or healthcare access on their own, right? That's not what's expected of the SLP or just the individual in any setting, whether it's a school, a healthcare facility, a private practice, anything like that. But really what you can do is start by just sort of talking about SDOH. And you're going to hear me say that a lot of different times
Mhm.
throughout the rest of this conversation. But screening for SDOH is a really big intervention that you can implement that makes a huge difference. That's, for the most part, can be relatively low effort, just depending on your facility. And I don't mean effort in the sense of like it's like a lazy intervention or anything like that. I mean more like you will get a lot of bang for your buck in sort of
Right.
screening for SDOH.
And that also comes in just having that open line of communication
Yeah.
and building that
Yeah.
rapport with the family. So, I think
Yeah.
a lot of SLPs are probably doing that, and they don't even realize they're doing it.
Exactly.
Right.
Yep. Yep. And some examples I had for that were like starting to build SDOH related questions into like your intakes and case histories.
Mhm.
Just, sort of asking patients about that, initiating conversations with them. If you work in a facility where you can do like a QI project to employ a formal SDOH screening tool or questionnaire, if you don't have one already, that's a great option. And note any SDOH information shared by other members of your patient or client's care team and, review their documentation and other notes that other members of the team are writing so you can kind of be aware of what's going on in their lives. In addition to that, I also like to recommend making referrals and connecting clients to resources. So, if you know that the patient has a social risk or an unmet social need, working with a caseworker or social worker, to kind of connect them to some resources. Or there is a really great tool on our website. I think it's called findhelp.org, where you can put in if that's not the correct link, then it'll be on there and I can point to it
Okay.
for everyone. But what you can do is put in your patient or client's zip code and it'll bring up some
Oh,
resources
wow.
that can help bridge some unmet social needs.
Yeah. And I'm thinking about in the school system, a lot of times, I think the biggest impact that I see are for kids who need glasses.
Yeah.
They fail the
Hmm.
vision screen, and their parents don't have the money to get them glasses, and it's
Yeah.
heartbreaking, but in the school system, we typically have those resources, like you said. There are teams of people that will come out, there are doctors that provide those services, but I think this last year, I had 2 kids on my caseload that they couldn't see. And they would
Yeah.
say, I mean, they were middle elementary, so they were old enough to understand and say, I can't see this. I can't see the text. I can't see the board." The teachers were moving them closer to the room, and I noticed it when they came to speech because they were getting, like, right close to my computer, and I was like, "Are you having a hard time seeing that?" So I just sent home a quick screener permission, and the nurse pulled them and screened them, and she was like, "They failed miserably." And then,
Yeah.
6 months later, the school year's over, and they still don't have their glasses. And it's
Yeah.
so heartbreaking.
Yeah.
It's so
Yeah.
hard. And we often, we take for granted that, and not everyone has the same opportunities and the
Yeah.
same access.
Mhm. I keep fixing my glasses here because they're new and they keep falling off my face, and, like, I'm taking that for granted, right? That, like, I was able to go out and buy a brand new pair of glasses because I wanted a new pair of glasses
Mhm.
because I was bored of my old ones,
Right.
right?
You just wanted a different color. And it's so hard to I think, I keep going back to that early intervention situation that I was talking about, and I remember us going out for the child who the family lived in a really small apartment. I think there were multiple family members living there, so there was stuff
Sure.
everywhere, and I remember us going out as a team and rearranging, asking them, "Hey, do you mind if we help you rearrange your living room just a little bit?" Because we
Yeah.
had to get some adaptive equipment in there, adaptive seating, walkers and that sort of thing. And we just, all of these needs that the child had and the family wanted them and they were trying their best to get them and they were doing all of the right things, but just physically in their home, there was no room. And the child's, bedroom was upstairs. And so you've got a mom that's trying to carry this child who's getting bigger and bigger every day. And I remember having that conversation, the physical therapist saying, they're 2 now, but in 5 years, they're gonna be 7, and then
Right.
they're gonna be 12, and then they're gonna be 16. So, we really need to take a look at where you're living because how are we gonna get them? You're not gonna be able to carry them upstairs forever.
Exactly. Yeah. Yeah, and that's a really great point about, like, neighborhood and built environment because
Mhm,
that's kind of what your house looks like, right? And what
mhm,
your neighborhood is like and how you navigate that. But then there's also that sort of economic stability piece of it too.
mhm.
Like, can you afford to make changes to your home?
Right,
Like, I live in a one-bedroom, one-bathroom condo in a city, and if something happened, to myself or my husband, like, we can't change the way our condo looks,
right.
like, and that's a huge piece of things that you don't realize, like, yeah, we're homeowners, right?
Mhm,
We have this that's a protective factor, but how that can so quickly slide
right.
into a social risk and an unmet need. And I love you kind of talking about collaborating with PT
Mhm,
because I think interprofessional practice is so important when it comes to SDOH because it really requires all of us, to kind of work together and sort through, what's a risk, what's protective, what may turn into an unmet social need, and kind of where can we bridge that gap for patients.
right, and I never really understood the importance of, in early intervention, they do the bagless model. So they don't want
Mhm.
us taking all of these toys into the home. We wanna send our therapists into that home to use what they have because
Yep.
we don't wanna take these toys in there that they don't have access to. And even something as simple as a cup, an adaptive cup, maybe when you're trying to transition from a bottle to a sippy cup. They don't have some families just don't have money aside to purchase that cup. And then I can't tell you how many sippy cups I bought. I mean, I bought so
Sure.
many sippy cups over the years when I was in early intervention and just trying to provide them with the basics that they need.
Yep.
And it's not
Yep.
even the extras and that we all probably take for granted. It's really hard.
Yeah.
So it's so
Yeah.
important for SLPs just you know, to consider these social determinants as you're going in and asking those tough questions. And
Yeah.
that's where it starts. Like you said, the number one thing we can do is to get to know our families, know what their situation is, know what kind of support system they have. And I know that that's done extensively in early intervention, but in
Yeah.
other settings it's not. Like I said, for me as a school-based speech pathologist, that's not something that I consider, but do I see the effects of it? Absolutely, because I had several kids that needed glasses and didn't get them all year. So
Yeah, yeah, for sure. I mean, I can give an example of like when I worked in the NICU, I was at a pretty big community hospital that was in, like a relatively economically flourishing area. And then my hospital system acquired another hospital that was in a different area and just had a whole set of patients with different SDOH. And just seeing how unprepared we were to
mhm,
manage that difference, and one of the biggest things was that the parents who were living in that area were 45 minutes away from our hospital, and there wasn't consistent public transportation that could get them to us, and a lot of them didn't have cars or a way to get there. So, they just had a preterm infant or a sick infant. They can't get to the hospital to visit them. They have to get back to work soon, and we were just really unprepared to manage any of those issues, and it took a while, for sort of the rest of our staff to catch up to be able to, help sort of meet those unmet social needs for those patients.
yeah, and then you just have to pivot. You have to reconvene and be like, "What are we gonna do?" Like, we've got these
Yeah,
patients that have these needs, but they can't access us, so what do we do? What do you do at that point?
yeah.
How did you guys pivot and adapt to that situation?
Yeah, that's a really good question. We worked hard to make sure that when parents were able to visit, that they were able to hold their baby, that the staff that they needed to meet with was available to see them, whether it was, later at night. There were a couple times where I was working with some of those babies on feeding, and I would stay later into the evening, to be able to be there to meet with the parent. But we also worked with our hospital's charitable foundation to get some rideshare gift cards so we could help them, sort of afford to be able to get transportation to us. And our social workers also help set up rides for them
Mhm.
to take that stress off of them that they didn't have to, do it themselves.
Right. That's so interesting that you said the ride share because a light bulb went off and I was like, "Wait a minute. I started working in 2000." I was started
Mhm.
early intervention in 2000. I graduated in
Sure.
'96. We didn't have rideshare back then. So, it
Yeah.
was trying to set up a taxi, trying to set up a cab, something like that, and that's not always easy, and it would be so easy now for me to just be like, "Okay, I'm gonna send an Uber to you," and just,
Yep.
getting it on my app and sending it to someone, or having maybe not your personal one, but the facility having that ability to do that, I think would be so much easier than it was back in the 2000s when there were no iPhones. I know my daughter's like, "Wait a minute, there was no iPhone in 2000?" I'm like, "No, girl, things have changed so much." So, Stephanie, this has been so amazing. This information is great. What advice do you have for SLPs? What would you tell them about SDOH and how they can access and help their patients access their services?
Yeah, I love this question so much, and I'm gonna repeat what I sort of said earlier. Just start talking and thinking about
Mhm.
SDOH. Talk to your colleagues about it. Bring it up with the IPP team. Talk about, what sorts of protective factors you're seeing with your patients. What social risks are you noticing amongst your caseload? Or what consistent unmet social needs are you seeing in the populations that you're working with? And this is challenging, but I wanna kinda say, like, find a way to talk to families that offers sort of, like, mutual comfort for both of you because this can be a really challenging conversation.
Right, and that's what I was thinking about when we decided this would be the topic for the podcast today. I was like, those are very tough, difficult,
Yeah.
uncomfortable conversations and questions to ask, but we have to do it as
Yeah.
professionals.
Yeah, I often started conversations with parents by saying, like, we ask everybody these questions. There's nothing different about you. It's just, to see where we can help you. We have a lot of resources. And I would often give them an example from myself. Like I said before, I'm comfortable talking about that stuff. People aren't. And that's fair.
Mhm.
And like, that's respectable. You don't have to. But sometimes, letting them kind of getting on their level and, letting them know that this is a safe space and that the information that they share is, safe with you and that you want to help, can sometimes sort of open the door to having that conversation with them.
Yeah, and I would say I would add to that understanding the culture of the family
Yeah, 100%.
because not all cultures are like ours where they're that open
Yep.
to talking about those personal type of questions. So understanding what the culture is of the family that you're working with.
Yep. That is a fantastic point, and I'm really, really glad you brought that up because
Yeah,
it's so important.
yeah. So, this has been awesome. I've learned so much. I do wanna pick your brain. Maybe
Great.
we'll have you back on and talk about the NICU and the dysphagia and the swallowing, all of that. It's
Sure.
fascinating to me. But I wanted to ask you, are you gonna be at ASHA this year?
Yes.
Oh,
Yeah.
that's so
So,
exciting. I'm gonna get to meet you. I'm
yeah.
excited. So, this
Yeah.
is ASHA's centennial year coming up in November
Yep.
in Washington, DC. So, to all of our
Yep.
listeners, AMN is gonna be at booth 3312, 3312. So, write that down, Stephanie, so that you can come find us and meet with us. I know we're gonna be doing a podcast closer to ASHA, talking about all of the wonderful
Perfect.
things that are gonna be there for the centennial year. So
Great.
Stephanie,
Great.
thank you so much for joining us today and for all of this amazing information. We're going to have all of the links that you talked about from ASHA and any other links that you would like to provide us. We're going to have them linked in the podcast. But thank you guys so much for listening, and you guys have a great day. Thank you for tuning in to SLP Full Disclosure. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and SLP opportunities on our Instagram at AMN Allied. Special thanks to AMN Healthcare for making this show possible. See y'all next time.